beginning the exam, we would have the patient empty their bladder. We would get a height and a weight and a full set of vital signs. And to begin our assessment, we inspect the head. We look for symmetry of the ears and the eyes, which they are. And then we palpate the scalp. We palpate for any lumps or lesions, noting that the skin moves freely over the head. We're going to test the cranial nerve function by having you wrinkle your forehead, squint your eyes, clench your teeth, smile, puff your lips, and stick your tongue out. Okay. Now we're going to palpate the facial bones for any kind of tenderness. We also palpate the sinuses for tenderness. Now we palpate the temporomandibular joint. Open your mouth and close it, noting that there's no popping and clicking, which is what you would look for. Then we're going to test for light sensation, which also tests the cranial nerve function. You just tell me if you feel this.
Yes.
Okay. And now we're going to move on to the eyes. We just inspect the eyes, looking at the eyelids, noting that there's no drooping. The eyelashes grow up and out like they're supposed to. The eyebrows grow out towards the outer canthus, which is how they're supposed to. We look at the sclera, noting that it is white and there's no lesions. We look at the conjunctiva, noting that it is pink and moist with no aging date. And then we're going to palpate the lacrimal apparatus, noting for any tenderness or swelling. Then we're going to check pupillary response. We do both direct and consensual in both eyes. Direct, consensual, direct, consensual. And then we are going to perform the cover-uncover test. So I'll have you focus on a spot on the wall and cover your left eye, uncover, cover your right eye, and uncover, noting for any extraocular movements or nystagmus. So now I'm going to have you cover your left eye while I cover my right eye, and you just tell me when you see my fingers. And we're testing for peripheral vision when we do this.
Okay. Yeah. Yep.
Alright, switch eyes.
Yep. Yep. Yep.
Okay. And now I'm going to have you follow my pin light through the cardinal fields of gaze, and this also tests cranial nerve function. So keep your head still and try to just follow it with your eyes. Good. Noting that the eyes transition smoothly. There's no extraocular movements or no nystagmus. So then we move on to the ears. We palpate the auricles, noting for any tenderness. Then we're going to inspect the tympanic membrane and the ear canal. We note that the tympanic membrane is gray and pearly and there's no redness or swelling in the ear canal. Then we perform the whisper test. You'll have to kind of turn this way. I'm going to whisper 2 words and you just tell me what was said.
Harley. Hello.
Okay. Now turn back this way. Now we will perform the Weber test. You just tell me if you hear this better in one or the other ear, if you hear evenly in both.
Evenly.
Okay. And now we perform the Renee test, where we place this on your mastoid process, and you'll tell me when you stop hearing it, and then we'll place it out here, and you'll tell me when you stop hearing that.
No. No.
Okay. Do it in the other ear.
No. No.
Good. Air conduction should be twice as long as bone conduction. So now we move on to the nose. We just inspect it, noting that it's midline to the face. We inspect the septum and palpate the septum, noting that it is midline as well. There's no deviation. Then we inspect the inside of the nose, looking at the mucosa, noting for any kind of drainage, any kind of blockage. The septum is midline. There's no deviation. Turbinates are intact. There's no abnormality there. We're going to have you check patency by closing one of your nostrils And take a deep breath in. Good. And then switch nostrils. Good. And now we're going to move on to the mouth. First, we inspect the lips, noting that they're pink, moist, there's no dryness, cracks, or fissures. We move on into the inside of the mouth. We look at the mucosa. We look at the gums. And then we look, stick your tongue out. We look at the tonsils, posterior pharynx. We look at the uvula, noting that it's midline. We look at the tongue. We look for movements, symmetry, which there are no abnormal movements. We look under the tongue and the floor of the mouth for any lesions. And then we look at the teeth, noting the number, color, and any kind of dental caries or anything like that. We also note oral odor, if there is any. Alright, now I'm going to have you open your mouth and say ah. And the uvula moves up like it's supposed to. Then we check your gag reflex, which is intact, noting cranial nerve function. Alright, now we move to the neck. We just inspect it, noting that the trachea is midline. There's no jugular vein distension. There's no obvious pulsations. And then we're going to palpate the trachea, noting that it is midline. We're going to palpate the thyroid by having you swallow, noting that it transitions smoothly. We palpate both carotid pulses, noting for the rate, the rhythm, and intensity on both sides. Then we're going to palpate the lymph nodes. We do preauricular, postauricular, occipital, tonsilary, mandibular, submental, posterior cervical, superficial cervical, superior cervical, deep cervical, supraclavicular, infraclavicular, and axillary, noting for any swelling, tenderness, pain. Alright, and now we're going to listen to the carotid arteries and the thyroid. So I don't hit you with it. We note for any bruise. Which are not present. And now we're going to test for range of motion in the neck by having you put your left ear to your left shoulder, your right ear to your right shoulder, your chin to your chest, and then your head all the way back. And then we're going to do the same thing against resistance. Push that way, to the right, to the front, and to the back. We're going to have you shrug your shoulders, which also notes cranial nerve function. Alright, now we're going to move to the arms. We just inspect them for muscle mass, which is symmetrical. There's no muscle wasting. We palpate for muscle mass. Skin is warm and dry. The nail beds are intact. We check capillary refill, which is less than 3 seconds. There's no clubbing or cyanosis noted. We check the brachial pulse. And then we compare them both at the same time, noting their rate, intensity. Okay. And then we test muscle arm strength. So just stick your arms out like this. Okay, push down. Okay, push up. Put them out like this. Push up. And push down. Okay, good. So now we're going to move on to the back. So you'll have to turn around. Alright. So we just inspect the back for thoracic configuration. We note the skin is uniform throughout. There's no obvious lumps, masses, lesions. There's no obvious curvature of the spine. Lean forward a little bit. We can palpate the spine, noting that there is no curvature. There's no hump, no scoliosis. Then we're going to palpate and percuss the costovertebral angles. look for tenderness. Okay, then we're going to palpate the entire back, noting for any tenderness. Then we're going to palpate for tactile firmitus. For tactile firmitus by having you say 99.
99. 99. 99. 99.
Okay. Noting good vibration throughout all fields. And then we palpate for thoracic expansion with the breath. Deep breath. Noting that expansion is symmetrical. Then we percuss the back, looking for any resonant sounds. Okay. And then we're going to listen to the lung sounds. Go side to side comparing. Take deep breaths for me. Noting that lung sounds are clear in all lobes. And then we're going to percuss for the diaphragmatic excursion. I'm going to have you take a deep breath and hold it. Noting for the sound change. I'm going to have you take a couple breaths and then breathe out and hold it. That would be it. Alright, and then we move to the front chest, so you can scoop back around this way. Alright, so we just inspect. Notice the color is uniform throughout. There's no obvious heaves, pulsations, masses. Then we're going to palpate the chest wall, noting for any tenderness. We palpate the pericardium, noting for any heaves, any vibrations, which there are none. We palpate the apical pulse. We note the rate and the rhythm and the intensity. Okay, then we're going to palpate for tactile firmitus by again having you say 99.
99.
Okay, we note good vibrations throughout all the fields. So then we are going to auscultate. First we do the heart sounds. Listen to the aorta. The pulmonic. Erb's point. Tricuspid. And mitral. And then we're going to listen to the lung sounds. We go side to side comparing. We also listen to lateral lung sounds. Lungs are clear in all lobes. Then we're going to percuss the chest, noting also for the resonant sounds again. We would note for any dullness, which would tell us if there was a pneumonia, which there's not, so that's good. Okay, and now we're going to have you lay back. And we inspect the abdomen. We note for symmetry of movements, any kind of waves, any kind of masses, any kind of pulsations which are not present. Then we start by auscultating the abdomen. We We listen to all 4 quadrants for vowel sounds. Then we're going to listen to the aorta. Then we're going to listen to the renal arteries, the iliac arteries, and the femoral arteries. And then we perform percussion. We percuss over the entire abdomen. We percuss the liver borders. We percuss for splenic dullness. Okay. And now we are going to perform light palpation, and this just tells us if there's any abdominal tenderness or guarding, any masses. And then we perform deep palpation to attempt to find the liver borders. And we attempt to palpate the splenic borders, which we shouldn't feel. We also look for the kidneys. Which we don't feel in this case. And then we have you lift your head up, and we inspect and palpate the abdominal muscles. Alright. Now you can have a seat back on the edge of the bed. And we're going to move to the lower extremities. We just inspect, noting for symmetry. The skin is uniform in color. The skin is evenly distributed. We palpate, noting that the skin is warm and dry. There is no edema. We check the popliteal pulses, the tibial pulses, and the pedal pulses. And then we're going to check for muscle strength. So I'm going to have you push back on my arms. And then push down. Good. Muscle strength is 5 out of 5 in lower extremities, so that's normal. Then we're going to test for your differentiation between dull and sharp sensation, which will note cranial nerve function. So you just tell me if what you feel is dull or sharp.
Dull.
You have to close your eyes too. Okay.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Okay, so cranial nerve function is intact. Then we are going to check the reflexes. We do the brachial. Turn this way. Okay, then we would check the knees. And then the Achilles. Okay. Let's see. And then we're going to have you stand up, and we're going to look at your back. Look, let's just do it this way so you can actually see. Once again, we just note any kind of curvature of the spine. Bend over forward. There's no curvature, no hump, no scoliosis. And that's it. And that, you can get up. And that concludes our assessment for Maryville University.